Hey everyone, welcome back to the channel. Today, we're diving into one of the most inspiring and crucial chapters in the history of medicine, the race to cure polio. And the man at the center of that race, Dr. Jonas Salk, who gave the world a vaccine that would change the course of history. In A Shot to Save the World, author Jeffrey Kluger takes us through the highs, the lows, and the groundbreaking moments that led to the development of the polio vaccine. Trust me, this is a story of perseverance, genius, and a shot that saved millions of lives. So grab your coffee, sit back, and let's explore the journey that helped make polio a thing of the past. In A Shot to Save the World, Jeffrey Kluger tells the riveting story of Dr. Jonas Salk and the monumental breakthrough that led to the development of the polio vaccine. The book takes readers on a journey through Salk's life, the scientific challenges he faced, and the immense pressure he was under to create a cure for one of the most feared diseases of the 20th century. Polio was a crippling and sometimes fatal disease that paralyzed children and adults alike, creating widespread panic every summer, as epidemics swept through communities, leaving devastation in their wake. Salk's story is not only one of scientific brilliance but also one of incredible resilience, as he navigated personal and professional obstacles to deliver a vaccine that would eventually save millions of lives. From the outset, Kluger paints a vivid picture of the polio epidemic, describing the terror that gripped America as the disease spread. In the early 1900s, polio was a silent killer. It struck suddenly and with little warning, often leaving victims permanently paralyzed. There was no cure, and the only treatments available were largely ineffective. Families lived in constant fear, and the disease became a national obsession. The book sets the stage by explaining the profound impact polio had on society, particularly on children, who were the primary victims. The disease's random nature, no one knew who would be affected next, added to its terrifying unpredictability. The idea of a polio summer, when epidemics peaked, became a terrifying reality, and a cure was desperately needed. Jonas Salk, who would later become the man to find that cure, was an unlikely hero at first. Born in 1914 in New York City to poor Jewish immigrants, Salk faced many challenges throughout his early life. He was neither a natural academic prodigy nor someone with a deep family legacy in science. But Salk's keen interest in medicine began early, and he would eventually become one of the most influential scientists of his generation. Kluger takes readers through Salk's formative years, showing how his personal drive and curiosity shaped his scientific career. Despite not having the glamorous background of some of his contemporaries, Salk was determined to make a significant contribution to science, and it was his work in immunology that would eventually lead him to the challenge of developing a polio vaccine. The book provides a fascinating look into the world of medical research in the early 20th century. Kluger paints a picture of an era where scientific innovation was booming, but the tools and technology available were limited. Researchers were working with rudimentary equipment, and there was no guarantee that their breakthroughs would lead to anything concrete. Polio was an especially difficult challenge because, despite its devastating impact, little was known about the virus itself. Salk and his team had to start from scratch, working in a time before genetic sequencing and with only limited knowledge of how viruses functioned. A key turning point in the book is when Salk moves to the University of Pittsburgh and begins to focus on polio. He realized that in order to beat the disease, the solution would likely come from a vaccine, a preventative measure that could stop the virus before it spread. Kluger delves into Salk's methodology and thought process, showing how he was able to develop an innovative approach to creating a vaccine. Unlike many other researchers at the time, Salk was not trying to create a live version of the virus that could be injected into people, as many vaccines were designed to be. Instead, Salk and his team used killed, or inactivated, polio viruses to build immunity. This was a bold, untested approach, and it was one that would be met with skepticism by many in the scientific community. Kluger also introduces the challenges Salk faced from both within the scientific community and outside of it. Developing the polio vaccine was a monumental task, and Salk had to deal with skepticism and competition from other researchers, many of whom were working on their own vaccines. The race to develop a polio vaccine was intense, and Salk had to work quickly while maintaining the scientific rigor necessary to ensure his vaccine would be safe and effective. Kluger highlights the complex dynamics of scientific rivalry, where Salk's approach was sometimes criticized for its unconventional nature, and yet he remained steadfast in his belief that the inactivated virus was the key to solving the problem. The book also explores the critical moment when Salk's vaccine finally moved from the lab to real-world testing. After years of research, Salk's vaccine was ready for a large-scale trial. The stakes were incredibly high. Salk's name was on the line, and the lives of countless children were at risk. Kluger describes the intense drama surrounding the vaccine's first public testing, the challenges of administering the vaccine to thousands of children, and the pressure Salk and his team faced as they anxiously awaited results. The trial, which took place in 1954, involved over 1 million children and was the largest medical experiment of its kind at the time. Salk's vaccine would either prove to be the key to eradicating polio, or it would be a monumental failure. The results were nothing short of groundbreaking. Salk's vaccine was proven to be effective, and the world was on the cusp of a polio-free future. In A Shot to Save the World, Kluger not only recounts the scientific triumphs but also the personal side of Salk's journey. Despite his success, Salk's life was marked by internal conflict and external pressures. The book delves into Salk's relationships with colleagues, his family, and the media, revealing the complexities of his character. He was a man driven by a sense of purpose, but that drive sometimes strained his personal relationships and his ability to connect with others. Kluger takes readers into Salk's personal world, showing how his commitment to the vaccine project often took precedence over everything else, including his own well-being. Yet, despite these challenges, Salk remained deeply dedicated to the idea of making a selfless contribution to humanity. He famously chose not to patent the polio vaccine, a decision that meant he would not personally profit from his discovery. His reasoning was simple: he wanted the vaccine to be distributed as widely as possible, and patenting it could hinder that goal. As the vaccine was rolled out and polio cases began to dramatically decline, the world began to recognize the monumental achievement of Dr. Jonas Salk. Kluger traces the global impact of the vaccine, showing how it ultimately led to the near-eradication of polio, particularly in the United States. However, the book also addresses the challenges that remained, including the persistence of the disease in other parts of the world and the occasional setbacks in vaccine development. Yet, the overarching message of the book is clear: the development of the polio vaccine was a turning point in medical history, one that changed the way the world viewed the power of science and the potential for global health initiatives. In the final chapters, Kluger reflects on Salk's legacy and the broader implications of his work. The polio vaccine was not just a cure for a single disease, it represented the potential for humanity to overcome some of the greatest medical challenges of the time. Salk's work laid the foundation for future vaccine research, inspiring generations of scientists to continue the fight against diseases like smallpox, measles, and even new threats like COVID-19. Salk's story serves as a powerful reminder of what can be achieved through determination, innovation, and a commitment to improving the lives of others. In conclusion, A Shot to Save the World is a captivating account of the life of Dr. Jonas Salk and his groundbreaking work in developing the polio vaccine. Jeffrey Kluger masterfully weaves together the scientific, personal, and historical aspects of Salk's journey, providing readers with a deeper understanding of the challenges and triumphs involved in one of the greatest medical achievements of the 20th century. Through this narrative, Kluger not only honors Salk's legacy but also underscores the importance of scientific collaboration, perseverance, and the drive to make the world a better place.